Hi everyone, my name is Stella Fokokomera. We are here to talk about HIV and tuberculosis. So what is HIV? HIV, this is a virus that affects the immune system. It fights the T cells of the body that affects the immune system of the body. So it fights the defense system of the body. So how do you get this HIV? You can get HIV in various ways, and one of them is through having sexual intercourse with a person who is HIV positive. So you can also get HIV by birth. During delivery, mothers usually transmit HIV. If they are positive, they transmit HIV to the unborn to the baby. Then the other way you can get HIV, like for people who abuse drugs, drug abusers, they tend to use injections to inject heroin in their bloodstream. So those injections, they can carry the virus from one person to another. Then also you can get HIV in accidents, like you've been involved in a road accident, then you're seated next to a person who is HIV positive. You can get the virus through that. So my colleagues are going to continue on the effects and how you can prevent HIV and AIDS.
Hello everyone, my name is Happy Musuki and I'm here to talk about how we can prevent this HIV. As you said, there are a lot of ways in which you can contract this HIV, and there are also ways in which you can prevent HIV. One of the best ways of preventing this HIV is by abstaining. Us as adolescents, we are here in school and outside there, we are adolescents, we are not ready for sex. So here in school and outside there, as we are adolescents, in short, we are not ready for sex. We can just abstain. That's the best way. But due to feelings that we develop as adolescents, we develop sexual feelings, and at some points we even fail to control them. So it is the other way that we can use to prevent ourselves or to prevent this HIV is by using condoms correctly and consistently. What do I mean by correctly and consistently? Consistently meaning you use condoms each and every time you're having sex, not maybe the first round you use a condom, the second round you do it unprotected. That's not consistently, and that's you can contact HIV that way. So apart from that, we can also avoid sharing needles, sharp objects, and erasers with others. Apart from that, there is also there are medicines that we use. There is PEP and PrEP. These medicines like PrEP, we can take them immediately, like you know that you might have sex with someone unprotected. You know, like adolescents in here, we usually have sex unplanned. Maybe you have a boyfriend, you have a girlfriend, you just meet, you have sex. You didn't even plan to have sex with that person. So if you know you might have sex unprotected, you can take PrEP. That will help you to protect yourself from getting HIV. PEP, it is a medicine that is taken immediately after having sexual intercourse or unprotected sex with a person you know you haven't trusted that person is not trusted, or you don't know the person. Sometimes you might be raped. So you don't know the HIV status of that person. So there is a medicine that is taken in order for you not to be affected or not to get that HIV, which is PEP. If they know that they are HIV positive, they should visit hospitals to take medications in order to protect the baby from contracting the HIV. Apart from that, there is also going for testing. Make sure you go for testing regularly. Maybe every after 3 months you go for HIV testing. It is very important to know your HIV status, if you are positive or not. In that way, you protect yourself, you know how to protect yourself, also how to protect the people around you. Remember, if you find that you are positive, it is not the end of the world. There are a lot of ways in which you can stay safe whilst you are positive. You can be positive, but you are living a healthy life by taking medications, by adhering to the medication that will be given and all the rules that will be given in the hospital. So, in conclusion, I will say, as adolescents, let's protect ourselves from HIV. And also, if we know we are tested and we find that we are positive, don't discourage yourself. It is not the end of the world. you can still be successful in life if you are HIV positive. Remember, it is not a limitation to success. There is also U is equal to U, where when you are positive, you are adhering to the medication. You can reach the point where undetectable is equal to untransmissible, meaning you can reach the point where when you go to the hospital to be tested, you find that maybe it won't show that you have you are HIV positive. It can also not be transmitted sexually. That point can only be reached when you are adhering to medication that will be given. In that way, you will be successful. At this point, allow me to call my colleague who is going to talk about TB. Thank you so much. By the way, remember, PEP is taken 3 days. So once you have sexual intercourse and protected with someone you're interested, you within 3 days or within 72 hours, make sure you start taking PEP. Thank you so much.
Hi everyone, my name is Mr. Martha and I'll be talking about TB. So tuberculosis, this is a disease that is caused by a bacteria. I'll be talking about TB. Tuberculosis, this is a disease that is caused by a bacteria or germ called Mycobacterium tuberculosis. So this disease mainly affects the lungs and also it can affect some other parts of the body, which can be the brain and also the this disease TB or tuberculosis, which is commonly known, the signs and symptoms, it can include coughing, night loss, and fever. So many are the signs that they can be there, and also how can you get affected of it? You say that you can get affected by that bacteria. So how can you treat it? How you can treat it by when you are born, you can also get PCG at birth, and also you can visit the nearest hospitals to check if you are having this sign, to check if you have tuberculosis. Then, and also you are supposed to avoid crowded places that can also lead you to contract tuberculosis. So that's all we had for you on tuberculosis. Hope you like the video and subscribe. Bye.